I am sharing a very interesting infographic. It's an epidemic calculator. You can see the website where you can find this up above. Feel free to go find this and play around with it as you see fit. I will be explaining some of the aspects of this infographic and how you can use it and what we can learn from this. The main takeaway from this infographic is the incredible importance of early and effective intervention, meaning efforts that we can undergo to limit transmission, such as the self-quarantine that we've been doing, limiting transportation, limiting travel, limiting interaction between individuals. It may seem like this is a big ask. It may seem like this is hype. However, you can see from this infographic that it really does make a difference. And like the Dr. Landon, I believe her name was, who spoke last night, if you don't see anything happening around you, that means what you're doing is working. So I want to show that with numbers here using this epidemic calculator. So let me just explain a few things first. It does show exposed, infectious, hospitalized, and fatalities. Here you can select also susceptible, removed, and recovered if you so wish to show in the main infographic here. There are quite a few number of sliders that you can adapt based on what variables you want to change. The variables that I changed are the size of the population, so that's roughly the US population. It's difficult to get these sliders to be exactly where you want them to be, but that is roughly the size of the US population. For the number of initial infections, I selected 10,000 because at the beginning it was not really clear how many people were infected. As of 4 days ago, we had 10,000 infections. Currently, there are 33,000 confirmed and presumptive cases according to the CDC. So I selected 10,000. That's as far as the slider goes. And I will use that as a sort of baseline. Now, the reproduction number, the R naught, this tells you how many people will be infected from one person who's infected. Now, the authors set this at 2.2 based on previous data. They also set some of these others, like incubation period and duration the patient is infectious, based on studies that have been conducted since the COVID-19 virus broke out. So I did not change those. These are numbers that are based on the research that we have thus far. One thing I did change, however, the authors did put a 2% morbidity statistic in here. I changed that to 1.5%. It's what we've been seeing in the US so far. However, of course, this could change if hospitals are not getting the resources that they need in order to treat people who are seriously ill from this disease. The other statistics in here, like hospitalization rate, etc., I found were they made sense. So, but again, you can go to this website yourself and change those if you do not believe those are accurate. So let's get down to the nitty-gritty here. So if we do no intervention, and this is starting, day 0 would be 4 days ago when there were 10,000 cases. If we do absolutely nothing, we have an R naught, or transmission rate, of 2.2, meaning when one person is infected, 2.2 people will become infected by them. They will spread that to 2.2 people on average. So after 200 days, right here, you will have a total fatality number of 4.2 million based on this model. Now, if you do conduct an intervention, about 4 days ago, we were doing some interventions here in the United States. Let's say those interventions are about 25% effective, reducing the transmission rate by about a quarter. We still end up with 3 million fatalities. Now, let's say those interventions are actually much more effective. Maybe they're decreasing transmission by 50%. So let's see what that looks like. only 14,000 fatalities. So you can see it's an extreme difference when it comes to this sort of exponential growth, the magic of exponential growth that we see in our savings accounts and investments that we make. This is operating here in the transmission of a virus. So it's incredibly important to decrease transmission. So let's say, maybe our interventions right now are not that great overall as a country. And let's say, maybe in about 2 weeks, 3 weeks, we decide, oh, wow, we really need to up the ante here. And then we are able to decrease transmission by 50%. You are left with 153,000 fatalities. Let's say it's still not that great. You have 3.2 million fatalities. So, once again, the effectiveness of intervention is incredibly important. We still have time, of course, to do so. You see, if it's 75%, I don't believe that it really realistically would be more than 75%. We still need to go to the grocery store. We still are getting deliveries in our house, which we should do. It's not going to be perfect. However, you can see how effective this is. If we all work together to decrease transmission, you will see an effect. So this is not sensationalism. It's not a way to get people scared, to cause panic. It's simply reality. It's simply numbers. And the only way to reduce numbers in a situation like this is to decrease transmission. So thank you to everybody who's doing your part in that. And I know it's difficult, and there's a lot of negative repercussions that we're facing right now because of that, people losing their jobs. But it will be worth it, even if you don't actually see it with your own eyes. It is happening because we can see very clearly what the counterfactual is. So that is all I have to say about that, and thank you for watching.